Hello, welcome. My name is Mandy Tavonen. I'm the Managing Director of Innovation for Gordon Food Services Innovation Hub, RelishWorks. Thank you for taking the time to be with us today. We know that you're getting plenty of Zoom invites these days, so we appreciate you joining ours. We're here to talk about Trust20. We created Trust20 out of a need. Our restaurant customers were expressing three things. One, a fear of opening without having proper guidance for how to open. Two, too much disparate and inconsistent advice and counsel about how to open. And three, they were expressing a need for communicating the standard that they're adhering to their guests and to their employees. We called it Trust20 because we believe we'll look back and recall 2020 as the year where health and safety went beyond food handling, where it required a fresh look and a new bar for what it means to create a healthy and safe environment. We did this through countless hours of research, conversations with experts, some and most of whom you'll hear from today. When we were thinking about this, creating this place for operators to go to get information about how to open, my team asked me, why us? Why would we be the place that could do this? And it's very clear. We've spent, as Gordon Food Service, nearly 125 years in restaurants, in the kitchens of our customers. And in the absence of, and even in addition to government guidelines, we want to help restaurants understand the bar, execute against it, and communicate what safety and health looks like in today's world. And we all want the same thing. We want our restaurants to open. We hope that in the discussion today, which will be about 40 minutes, and then we'll have time for Q&A, that it will give you an understanding of the virus itself, that you'll walk away with some practical information about how you can use these guidelines in your restaurant. And third, that you will find trust20.co as a place that you can go and download a checklist, download communication tools for your website, for your Instagram, for your door, to communicate to your guests and to your employees that you are following a standard. I'm really excited about the panel today. I think we've just established this all-star group of people. So without further ado, I'll introduce them and we'll get rolling. So first we have Dr. Larry Kosiolek. He is an attending physician of infectious diseases at the Lurie Children's Hospital of Chicago and an associate medical director of infection prevention and control. We have Rick Kollick. He's the director of nutrition services at U of M Metro Health. Alicia Cieslak, she's the chief legal and risk officer for Gordon Food Service. Eric Losi, who is a Gordon Food Service chemical expert. And Catherine Miller, who is the Vice President of Impact at the James Beard Foundation. Thank you all for being with us today. So let's start because we're all hearing a lot of news about COVID-19. Dr. Kosiolek, could you tell us a little bit about what we know today about the nature of the virus itself? What do we know about what this virus is? And just so we can kind of start there as a foundation before we learn how to prepare for it.
Sure. So, there's not really much, interesting or new about this virus compared to other respiratory viruses in terms of how it's transmitted. It's transmitted like other respiratory viruses, like the flu or other things that we get on a regular basis. But what makes it unique is that it's a new virus, and so our immune systems have never seen it before. So if you are exposed in the traditional ways, you're at higher risk of getting sick yourself and then transmitting it. And so similar to most other respiratory viruses, the most common route of transmission really is from the respiratory tract of people who are acutely ill, mainly with respiratory symptoms, and their infected secretions come into contact with the mucous membranes of someone who is not yet sick with the virus. And so the mucous membranes typically are the eyes, the mouth, and the nose. Those are the areas that is sort of like a portal of entry for the virus. And so the transmission mainly occurs through what are called respiratory droplets, which are these tiny particles that contain the virus and are spread from someone who's sick, usually in the first few days of illness or right before the onset of symptoms. And then those droplets make contact with mucous membranes of someone else in their vicinity. And so the important thing to know about these droplets is that they don't travel very far. They're relatively heavy. So if you expel them either from coughing, sneezing, or just a normal speech, they usually travel not more than 3 to 6 feet. And so if you're within 3 to 6 feet of somebody, those can have contact with your mucous membranes. But then they can also fall based on gravity and then contaminate the surfaces where they fall. And so normally the area of contamination is relatively confined. But if your hands become contaminated with the virus because somebody coughs in your office space and your laptop and your hands become contaminated, and you scratch or rub your eyes or pick your nose or grab an apple and you contaminate the apple and then take a bite, you can infect yourself from the virus particles on that surface into your mouth or nose or eyes. Sometimes though, these droplets can be small and so small that they're a whole lot lighter. And when they're light, gravity doesn't pull them down as fast, so they can travel a farther distance. And so this has been something that's been, I think a bit unclear about how relevant these are for spread, but we do know that particularly in enclosed spaces that are poorly ventilated with a high concentration of people, and when people are coughing or sneezing, for example, that they're more likely to generate aerosols that can travel over a longer distance. And so that's less pertinent in healthcare facilities, which tend to be modern, and the ventilation is designed for that possibility, but restaurants and other indoor spaces like office spaces and things may not be designed as such. So really to spread it, you need prolonged face-to-face contact with someone who's infected. That really is the most common way of spreading. And so if someone is coughing or sneezing, they're going to put a lot more of these droplets and a lot higher burden of virus into the environment around them. We're increasingly recognizing that people without symptoms can still shed the virus, particularly a few days, like 1 to 2 days before becoming sick, but they're thought to be a lower risk of spread. However, if you're breathing more heavily, or if that person is talking particularly very loudly, or they're laughing or yawning, or those sort of things, you can exhale more virus into the environment. And so that's why when we see these outbreaks in these factories where there's a lot of machinery, these infected people are there enclosed in a tight space for hours at a time, and they're talking loudly over the machine, and so there's a higher risk of an outbreak occurring in that setting. But in restaurants, you may be loud and busy and packed, and people are laughing and talking loudly, and so that certainly asymptomatic people can have a risk of transmitting in that environment. People frequently ask about stool. Stool is a fairly uncommon way to spread the virus, but that stool would have to have contact with your mucous membranes, and if you're washing your hands, the only way that's going to happen is typically through flushing of toilets, and those areas are typically not well ventilated. And if you don't have like an enclosed toilet lid when flushing, you can aerosolize from that route, but it's much less common than the respiratory tract.
You mentioned that the virus could end up being kind of lighter, and then I'm imagining it when I'm picturing it in my head, kind of trickling down, like one of my friends described it as glitter. And I'm curious. Let's say it lands on a table in a restaurant, what is the latest thinking about how long that it could remain infectious on a hard surface like a table in a restaurant?
Yeah, that there's been a lot of research around this, and what makes it hard is that like studies when they study this, if you find virus on a surface, it doesn't mean that it's actually viable and cause infection. But we can at least detect virus on non-porous surfaces and things for several hours or sometimes several days later. Now again, it's really the amount of virus that makes contact with your mucous membranes that's important. So I think direct contact with surfaces is going to be possible to spread the virus that way. But if you're performing hand hygiene and washing high touch surfaces, the likelihood of being exposed to enough virus from these surfaces to make you sick is going to be much less likely from just being in an enclosed space for 2 hours with a lot of talking and laughing and breathing.
Okay, great. And Eric, you've been in this industry for a long time, and obviously clean environment has been a priority for restaurants since the beginning of restaurants. And I'm just curious, what from your perspective might need to be done different than it has been, done previously?
Well, really at this point, nothing needs to be done different other than the main key of following the federal, state, and local health codes and follow it to the letter. I think moving forward, the things that are going to change are more of the stringent standards in which we're testing things like high and low temp dish machines, the concentration levels of, for example, quat based sanitizers in 3-compartment sinks, and now even going as far as mandating disinfectants inside the restrooms and other lobby areas. As the good doctor mentioned, that's one of the areas, at least in food service, that we tend to not focus quite so much on. And I believe that there's going to be a heightened focus on areas of those high touch points with disinfecting in non-food contact surfaces, and then obviously proper cleaning and sanitizing of food contact surfaces.
Can you describe the difference between disinfecting and sanitizing? Because we hear those words, I use them interchangeably.
Yeah, they're closely related, but two very different things. And I'm going to make a short question. It's a very long answer, but I'm going to try and shorten it up as best I can. When we sanitize, we're really looking at killing 99.9% of all the listed bacteria that you would find on the label, for example, which is EPA approved, any sanitizer or disinfectant. So we're only going to sanitize food contact surfaces, and again, killing 99.99%, or excuse me, 99.9%. We're going to have that dwell or remain wet for 60 seconds. So we're talking about common touch areas inside of a kitchen and also a dining room. So it's kind of broken up into two different areas. So inside of a kitchen, or what we call back of the house, it is really defined as anything that your food or the food would come into contact with while in the preparation of that dish for your guest. So that could be a cutting board, cutting utensils, even a can opener technically is a food contact surface, as the blade of the opener actually comes in contact with the food as it's being opened. So that's kind of more or less back of the house in the kitchen. So in the dining room or front of the house, it changes just a little bit. So instead of the surfaces that the food would touch, now we're focused on the surfaces that the guest would touch while in the process of eating. So that would include the table, the chair, not just the place setting, the tables, the cups, the spoons, things like everything that you would touch. Even the menu and a salt and pepper shaker are technically considered a food contact surface as you come into contact while in the process of eating. So that's sanitizing. Disinfecting is a little bit different. While in sanitizing, we're killing 99.9%, with disinfecting, we're killing 99.999%. So a little bit different. It's not quite 100%. That would be sterilization. That would be more for hospital operating rooms and things like that. But with disinfecting, instead of having a 1 minute or even a 2 minute contact time per the food code for food contact surfaces, we're looking at a full upwards of 10-minute contact time for non-food contact surfaces. And we're talking, again, those high touch points of like restrooms, lobby areas, things of that nature, but really hyper focusing on things like toilets, toilet handles, the soap dispenser, the sink surrounds, the sink faucets, including the light switches and doorknobs as well. But with sanitizing, we're looking at killing a lot of the foodborne illnesses like Salmonella, E. coli, Streptococcus. In disinfecting, we're able to kill maybe some of the more tougher fellas. We're now looking at C. diff, MRSA, Noro, and unfortunately, the human coronavirus or COVID-19.
Wow. So, I mean, you've obviously done this. Dr. Larry, you're obviously a doctor. And now I'm thinking, Catherine, what are our restaurant operators thinking when they're trying to navigate this world? How can you, represent the operators from where you sit, and the work that you do on behalf of them, and kind of give us a perspective of where they're thinking when they're trying to navigate this.
Yeah, no, thank you so much for having me. And it's really helpful to have the context of both the previous speakers. I think the restaurant community is probably like all Americans, right? And probably actually also like all global citizens. We're just feeling our way through this every single day. And every day feels like 7 days. So, we're already 3/4 of the way through 2020, right? And it's not just May. And I think, as you said, Mandy, in your setup, I think one of the challenges for the restaurant community at this time has been an inconsistency in guidelines, guidance, practice that they've from trusted sources. So really at the James Beard Foundation and through things like Trust 2.0, and we're trying to give restaurants the best in class information from the experts, the scientists, the lawyers, the designers, all of the people that will be involved in helping us navigate this. So I think one, everybody is feeling their way through it. No one's ever done anything like this in the US at this scale. I think also what we think about this as business interruption, we actually need to be thinking about this in some ways as the same way we would tackle any natural disaster in any community. It's just happening across the country all at the same time, right? So for us, in terms of the health and safety, we're really focused on, again, essentially safety first. What we heard, we've been doing snap polls of the James Beard Foundation membership, which is largely small independent restaurants. Typically, the majority of our restaurants have fewer than 50 employees. They've been around about 10 years. They have less than $10 million in revenue, even smaller margins. On top of that, the majority of them are actually owned by women. And that audience is trying to feel their way through this and trying to figure out how not only to be safe for their workers, but safe, not only for their customers, but also safe for their workers. So the other bit of this that they are really anxious for and interested in is information from the experts that help influence the consumer's behavior as well. Because we can sanitize all the tables, disinfect all the things, wash all the dishes, provide all the hand sanitizer. But if the customers aren't also operating at that same social contract, and with that same aspect of diligence, it doesn't necessarily do a lot of good, right? So that's the other aspect of that they're really trying to navigate. Just a couple other things we've learned from our research is, they're really deeply concerned about the costs and the challenges to that, either social distancing or the PPEs, the protective personal equipment, the additional costs of hand sanitizers, new sinks, new kitchens. It's very easy for all of us to prescribe them or recommend those aspects for the restaurants, but remembering that our community operates typically on less than a 10% profit margin, every new cost is a stretch to both the economic health of that restaurant, but also then potentially the cost of that food to customers, right? So suddenly restaurants become completely unattainable for many folks, even at, in the fast casual world of, not even just talking about fine dining. So they're deeply concerned about the costs and how to pass those along. They're deeply concerned about the consumer contract of that's, the best behaviors and making sure that how do they message that to customers, right? Are you going to need a mask to go into a restaurant? Are you going to need to wash your hands? What happens? We're already seeing that that play out in real time in different communities that have opened. So really, how do restaurants that are typically open for hospitality tackle that? And then, they just need, as Eric said, like follow the, the health safety standards of your cities and your states and your health and operations. So a lot of these folks aren't getting clear guidance on that. So I think it's also what makes a tool like, Trust 2.0 really valuable for them, because, a lot of these guidance and the rules and the regulations haven't been fully formed. Are in dispute, and so the restaurants don't know what to do. So for us and with partnerships like with Relish, and Gordon Foods, we're just trying to help these folks get the best possible up-to-date, up-to-the-minute information that they possibly can and help them navigate it themselves.
Yeah. it is a confusing time. I just noticed that yesterday in California, Governor Newsom outlined, in conjunction with their OSHA, and Alicia, you'll probably know more which exact department, but you know, their guidelines, and I read it, and it was like, you know, 300 lines of things. And when you kind of boil them up, they, in general, I kind of compared to the guidelines we're offering, and they're all, you could either look at it that way, or you could kind of look at it a layer above, and say, we're doing this. And I think it's difficult for an operator to navigate.
Yeah, and you know, I'll let the other folks, you know, chime in. I think one of the challenges that we have is also with that vernacular. Many of these things are guidelines. We don't yet know, will these things be factored into your health inspection grade, right? Is this going to factor your A, or, you know, does this make you an A, a B, an F, right? These are all guidelines. And so guidelines become very confusing, because what I would do as a, you know, as what I do in New York, wandering around with my microfiber gloves and my mask and my scarf and my wipes in my pocket to go to the grocery store, is very different than what my neighbor does. And you see it play out time and time again. And so when you look at that on the operator scale, what a honey butter fried chicken does in Chicago may be very different than what you know, another restaurant in another part of the world does. And so, you know, that's part of the, I think part of the confusing thing for the operator is, what's a requirement and what's a guideline, right? So
yeah. So Alicia, kind of, I'm gonna, knowing that that's kind of where we're at right now, I'm gonna turn the conversation over to you. And you know, knowing that that operators are confused here because of this notion of, is it a requirement? Is it a guideline? You know, what steps do you believe restaurant operators can put in place, or what measures can they take to mitigate risk?
So that's a great question, Mandy, and thank you for the opportunity to talk about these issues, because they're novel legal issues. And so interesting for the lawyers, but to the earlier point, confusing to business owners who are trying to figure out how they apply. So first and foremost, I would say that the executive orders that are issued by state governors are the orders that you should follow. So using that as sort of your baseline, really try to parse through those and understand those, how they apply to you and your operation. Now, some of these orders have mandated restricted dining capacity, and we've overwhelmingly heard, and I think the James Beard Foundation just did a study about the likelihood that restaurants would open with that limited capacity, and is it financially feasible? Some executive orders in some states also require staff to wear masks, gloves, other personal protection equipment. And I think we'll likely see that continue to evolve as more states open. Certainly from a risk mitigation standpoint, there's a number of things that should be done, but it's important to understand the legal framework that operators would be working in. So you have several different parties that could potentially bring claims as a result of exposure in a restaurant operation. Certainly your employees, as well as your customers. And from an employee standpoint, states are evolving their workers' compensation framework, and the law isn't as evolved as the virus is. So I think we'll start to see restaurants reopening, we'll start to see employees going back to work, and workers' compensation boards not necessarily catching up with the types of claims and issues that employees are encountering. From a customer perspective, the types of claims that may arise come from just a concept of pure negligence. And so negligence requires, in most states, that you prove a duty, a breach, a causation, and then damages or a harm. So in that instance, for somebody to bring a claim that they had been exposed to COVID-19 in a restaurant operation, they would need to prove that the restaurant owed them a duty to create a safe and sanitary environment. They breached that duty by not consistently applying the guidelines or the rules. that it actually caused someone to be diagnosed with COVID, and that that person experienced medical bills, economic losses, things of that nature. And so understanding that, I think it's important to not only follow the guidelines that are issued by health authorities, because that won't be a complete defense, and there isn't yet a safe harbor built in for businesses from a liability perspective, to also implement things like that are included as tactics on the Trust20 site. As a business owner or restaurant operator, you'll want to be in a position to say you did anything and everything based on all the available information to minimize the risk of virus transmission. And it's also helpful to have records of communications that you've given your staff, training materials, sign-offs from the staff, and that you consistently and effectively apply those mitigation tactics. So again, it's not a complete fail-safe. The law continues to evolve. There's a lot of debate on Capitol Hill for liability safeguards, particularly for food providers, including restaurants, but also grocers, distributors, and other manufacturers in the supply chain. So we'll continue to keep this group updated via Trust20.
Great. Yeah, you sent something earlier to me. Do you want to just mention it briefly, and we'll post it as well, but kind of the letter that was sent to?
For sure. So the National Restaurant Association, along with several other organizations like National Council of Chain Restaurants and other entertainment, hospitality interest groups, drafted a letter to congressional leaders on May 11th. The letter outlines really this conundrum that we're talking about, that operators could be exposed to litigation risks given the highly contagious nature of the virus, despite following the guidelines from public health authorities and government officials. So Mandy had mentioned that we'll post that letter. Take a look at it and call your congressman, call your senator, and see if they'll support that letter, because that really will be a vehicle by which restaurant operators will get potentially a safe harbor built into future legislation to avoid liability after reopening for these types of claims we discussed.
Yeah. So Rick, you've been operating during this entire time, obviously, as someone who's working in the healthcare industry, as the director of nutrition, you've been serving guests and staff members. And I'm curious what you've found, kind of what processes and guidelines have you been following to ensure, without guidance, what have you been following to ensure the health and safety of your people?
Good afternoon, all. Yes, it's been a trying couple weeks. The decision was made by us early to remove all the buffets, go to self-serve model in our cafe. We now offer prepackaged salad and sandwiches, self-serve pizza slices, as well as all the prepackaged salads and sandwiches. The decision was difficult for the staff because we've always been a fresh food company, but we have to do what we have to do. We've lost a considerable amount of income also, as patient, family members, and visitors can't enter the cafe to dine with us. We have offered laundry soap, toothpaste, coffee, and other essentials as like a C-store. We offer toilet paper when we can get it. But we are also selling whole produce items to, again, assist the staff and, not adding additional exposure on their way home. So again, it's, our volume has dropped about half. So like I say, it's been a week of furloughing and speaking with staff and trying to come up with a optimum schedule.
Yeah. I mean, I think there's a big part of this that is, and Alicia, you touched on it, Catherine, you as well, about kind of communication in general. And Rick, I'm sure that's been really important in the environment that you're operating. But, I guess, Alicia, what role do you think communication plays in, and how operators might be thinking about it differently? I mean, I think it's been kind of traditionally been thought of as like a marketing thing, but this is really something new and different, and more intentional and purposeful about communication. I'm just curious you could talk about that.
Yeah, so from a communication perspective, we talked a little bit about the types of things you'd want to have in place to protect from a liability perspective, but also I think being open and transparent about what it is you are doing, particularly enacting some of the tactics through Trust20, as well as the state, local, federal guidelines as they become apparent. A lot of folks, I think, struggle with the situation where you have a confirmed COVID case in your staff, or you've had a confirmed COVID case within your customer community. And so I think what's important is to simply have a plan. How will you manage through that situation? Because the public interest or the public health concerns likely outweigh the concern around individual liability. Once you have a case within your restaurant operation, you have a case. The facts are what the facts are. So to the extent you can be factual and you can't, you can't draw conclusions right away without knowing the information about the diagnosis. I think you need to consider, if an individual does fall ill, who that individual has been in contact with, who that individual may have waited on a table or been a host to, or what have you. That will be important to developing that communication plan. So I think the communication from a legal perspective, liability perspective is one thing, from a public health interest is another. And then I think just creating consumer confidence in dining in your establishment, all kind of weave together.
Yeah, I do think that consumer confidence, we were discussing as a team, and it's one thing to say you're open, and it's another thing to create enough trust with your community to actually be able to be open because you have business, you have customers. And I'm curious, Catherine, from your perspective, how do you see operators encouraging and kind of creating the trust for their guests to come back? And then I do want to talk about something that's important to you and to our operators, which is, how do we create trust for our operators that the guests are going to act appropriately?
Yeah.
and do you have any examples of that, or are seeing anything?
Yeah, I mean, I think what we're seeing immediately is, as people prepare to reopen, and, Alicia, thank you for referencing this study. We poll our members, as I said, at our SNAP polls. And so most people aren't going to feel comfortable reopening to the dining room until they can get to 50% or more capacity. And that's just it's a margins question, not necessarily, right? And also bringing back staff and everything that they need to do for such a small group of people for many operators is just not possible. So what we're seeing at this moment is the people who had not yet moved to takeout or delivery are now shifting to some sort of takeout or delivery, or, as Rick did, some sort of front-facing grocery or pantry or other pieces like that. And so they have this ability to kind of, start to adopt those guidelines now, right? So they're doing masks, they're doing kitchens with distancing, they are doing, gloves, sanitizers, taking temperatures. What the next layer of that we are going to start to see is is in support of contact tracing, right? So asking staff members to self-report whether they have been exposed or have had the disease or have the antibodies or don't feel well or what their temperature was. So I think we're going to start to see that. And we're going to also start to see restaurants, as we did when they were closing. I mean, I think one of the most interesting things is, as we reopen, is looking back at some of the things that people did at the very beginning in phase one of this that only lasted for a couple of days, which was they were already posting, we are practicing this, right? We are using paper towels and extra strength disinfectant, or I use them interchangeably too, apologies to the experts, the disinfectant sanitation tools. Right. So they stopped using rags or towels, right, to mop tables. They were using paper towels with the sanitizing pieces that they were already spacing tables. So but they were communicating about it, like to make people feel comfortable about continuing to come in. They had started to already do that. So we're going to see more of that. What we're now seeing on the operator side related to that social contract with customers, Nico Romo is a chef in South Carolina, and he posted on Instagram and on his website for anybody who's making a reservation, the 10 steps that they're actually going to also ask the customers, right? Here's the things we're providing for you. We're going to provide hand sanitizer on every table. We're going to wipe every table in between turns. We're going to have limited seating. These are the types of, you're only going to have your table for 90 minutes, all of that. That's what we're as a restaurant going to do. But as you as a customer, we've moved a sink to the front of the house. We've reinstalled the sink at the front of the house. You're going to be asked to wash your hands. You're going to be asked to use hand sanitizer. You're going to be asked to, different questions when you make reservations. And so just putting it up there and out front. And I think that may be in some ways may actually be easier for the smaller independent operator who has a strong relationship with their customer base in most cases anyway, right? The regulars at Thalia in New Orleans, or the regulars at Brown Sugar Kitchen in Oakland, they already have that relationship. And so they have that two-way conversation. I think it's going to be harder for people to attract new people into their business, but being safe and safety first may be a differentiator for them, right? Like if you're upfront and open about what you're doing to protect your customers, maybe the customers will start to maybe like, oh, I'll go there, right? So those are the two pieces that we're seeing.
Yeah, and it's interesting, when you hear from, the operators in your network, Catherine, do you have a feel for how their customers are feeling, let's say in Texas or Atlanta, other places, are customers coming in? How are they feeling about it when they are coming in? And
it's really mixed. I think most of the folks that we work with, within our community, most aren't back to full dine-in yet. They've, Pools Diner in North Carolina started to drive through, right? I never thought I would see that happen, right? Those types of things are still taking place, again, because I think most people in our community are really hesitant from the expense perspective to be open to dine in, right? But they're all preparing for that. They all want customers back in the door, right?
Right.
I think anecdotally, we're seeing around the country real tension between people who maybe don't believe this is a problem or believe in a different way of sort of representing their beliefs in less government or whatever their the pieces, and that's challenging. I mean, we've seen it in Colorado, we've seen it in California, we've seen it in Georgia and other places where the states are anxious to get small businesses back up and running, as we should be. This is a big economic hit to our country. But where people are, taking a different, maybe potential stance related to their own use of PPEs or their own social distancing. And that's where I think we're going to see more of that around the country, that tension. And you're already also seeing it on chat boards and places where people are making negative comments in both directions about, I'm not going to serve customers who don't have a mask, and why would they endanger my why would they endanger my staff and other customers, and customers who are like, I'm not going there because I don't need that, right? I just want a cup of coffee. So I don't underestimate that tension moving forward.
Yeah, I do. I see it here, and even, I don't know what your neighborhoods are like, but mine, 50% of us are wearing masks and 50% aren't. So if I can play that out in a restaurant format, I can imagine a similar.
Yeah, and I think restaurants are asking themselves about, in the past it was no shirt, no shoes, no service, right? Is no shirt, no shoes, no service going to move to no masks? And what does that really mean? And then, in the age of flaming people on the internet and Yelp reviews and customers, people are deeply worried about any sort of antagonistic relationship with potential customers. And so there is a real, it's going to play itself out over time, but there is real consideration and concern around how we might expand no shirts, no shoes, no service to no hand sanitizer, no mask, no service.
Right. Dr. Larry, I mean, the mask debate and originally we were told, don't worry about masks, and then wait, we need to have masks. and what is the nature of a mask, and is it good enough if it's not the kind that the physicians are using? I'm curious, what type of masks? Sounds pretty tactical, but I know our customers are asking is, what do they need, and should their employees be wearing masks, and should they require guests?
Yeah, so in the healthcare setting, we have pre-COVID, I mean, we would wear masks, and we have just a normal surgical mask, not an N95 or anything, and industrial or higher level of protection. Simple, surgical face mask when coming into contact with sick patients to protect your mucous membranes, your mouth and your nose. But outside of that direct face-to-face contact, the mask is better suited to prevent a sick person from expelling those infected droplets into the environment. And so I think what we discovered in this outbreak is that that this was more mild than we thought. And so there were a whole lot of people walking around with mild illness and potentially asymptomatic people or pre-symptomatic people before they got illness that were spreading. And so in our hospital, when we went to universal masking all our employees, the number of healthcare workers that we saw getting ill plummeted. It went down to, I mean, we don't have any clusters of healthcare worker illness anymore because they're not shedding into their environment. And so the mask will be important for your workers and your staff that are having face-to-face contact with other people, in addition to aggressive symptom screening and making sure they're not coming to work sick. The challenge really is, if you have a guest that's there for an hour and a half or 2 hours, and they're not going to wear a mask while they're eating, it's impossible, and so they still confer a risk to the rest of the people in the environment if they're coming sick or they're not very symptomatic, particularly if it's a very tightly enclosed space without a lot of ventilation. And so I think masks are incredibly important. It's unfortunate that masks are now being seen as sort of anti-American and a violation of public rights, but it really is just about math and odds. If you can reduce your exposure to other people, you will interrupt transmission and ultimately the outbreak will go away.
We have a question about the level is best for a mask or the requirement. It's ASTM. Embarrassingly enough, I don't even know what that means. So.
Well, I mean, I think when we're talking about like your industries, I mean, healthcare masks, like medical grade masks have a different grade depending on how tight, the filter efficiency is, how fluid resistant it is. Like for example, the surgeons wear in the operating room is a higher level of protection than what I would wear outside of the operating room and taking care of patients because I don't need the same level of splash protection. But when you're talking about like, out and about in public, these medical grade masks really aren't typically available, but, even the lowest grade masks will be effective. And even homemade materials like canvas and tightly woven cotton and things will still have a reasonable amount of filter efficiency, particularly for people that don't have symptoms, and so having a mask isn't a substitute for going out sick. I mean, you still have to have personal accountability, and restaurants are really going to want to figure out a way to do what we do in healthcare. We aggressively symptom screen, and we don't disincentivize not coming to work when ill. We figure out what that is, and restaurants will need to also figure out how to incentivize customers for not coming to work sick. If they cancel a reservation because they're ill, like, do they go into like a raffle at the end of the month that you can say, okay, a personal accountability award for our customers, and here's a gift card, or something like that. I mean, you figure out a way to not punish people for taking their personal accountability.
Yeah, that's a really good point. To all the attendees, we are open for questions. You can start to write them in the Q&A section if you haven't, which is on the bottom right hand of your screen. But I'm going to continue. Eric, if an operator that's listening to this call today walked away with like two new things, or just like that they should start doing now, what are the most practical to clean in the cleaning and sanitation from the cleaning and sanitation standpoint? What would you say to do?
Well, number one, I would plan on sitting down right now and putting your procedures down on paper. and make them repeatable and very trainable. Make sure that you have a plan in place for when you do open up. And you can rely, and Catherine, you make a great point about, not having consistency, but, people can always go back and look at their serve safe, books and so on and so forth. Also, don't hesitate to reach out to either your, chemical manufacturer or a distributor for assistance with that, to help you kind of put a plan together. Outside of that, our industry, we don't necessarily struggle with the raw materials to create a lot of our products as sanitizers and disinfectants. Where we struggle a lot of times is with the materials and packaging. Squeeze bottles, squirt cans, the trigger mist sprayers. Right now, if you're sitting on an empty spray bottle, you're pretty excited right now. So what we should do today is just hold on to those items. They're a hot commodity right now. So outside of that, really make sure that you have your plan down, and make plans for the future to either record those trainings for new employee onboarding and things of that nature.
Great. We have a question about a device that purifies the air. It's Advanced Solutions Public Protection Equipment. I'm curious, Eric, if you've heard of this, and it's a VUC light. And do you have any perspective on its
on its effectiveness? I can't really speak too much to its effectiveness. That might be possibly a sterilization of surfaces, but when you're talking about the air particulates itself, that's not exactly what we're focused on. We're focused on that cross-contamination of, either food or non-food contact surfaces themselves. So unfortunately, I wouldn't have much on that, but just obviously following that federal food code.
Great. And then,
yeah,
go ahead.
On that. So we use, we don't use that same technology, but certainly in most of our hospital rooms will turn over the entire volume of air quickly, like in even 15 to 20 minutes, and reducing the risk. But there are older parts in outpatient centers that don't have the same level of ventilation, and so those will help exchange the air. So the reliability of those devices really is related to the size of the room and how many air exchanges it'll do. The number, the overall bioburden of disease in that space. And so we do know that when we've attempted to try to put them into hospital rooms, they can be relatively loud and cumbersome, and they give off heat and can make temperature regulation in those spaces somewhat uncomfortable. And so, the best way to understand like how effective they would be to talk to an environmental engineer and base it on your particular space in the type of device that you're using.
Great. Alicia, there's a question about kind of this notion. I like, Catherine, what you were saying. It used to be no shirt, no shoes, no service. If we say no masks, no service, do we foresee any potential legal implications from that?
This is also another hot issue that lawyers are debating, both from the employment side as well as the public or patron side. From the employer side, the position that EEOC and others have indicated is if an individual cannot medically tolerate the mask because they have some pre-existing condition like COPD or something like that, they can be exempted from the requirement as an employee. Similarly, there could be a situation where an individual patron was turned away from a restaurant who has a pre-existing condition, can't medically tolerate a mask, and then they could make an argument or a claim that they were somehow discriminated against because of this pre-existing condition. And you get into a difficult situation, both as an employer as well as a business owner, of having to have these medical conversations that is inconsistent with what you've always thought was permitted. And we ourselves are finding this to be a challenge on a day-to-day basis as we continue to run our business. So there's no clear answer, and the favorite answer for lawyers always is what I would say is turning somebody away specifically because they don't have a mask, it would be difficult without some guidelines or guidance from a local, state or federal authority in that regard.
Right. So, Eric, there's another question out here that these supplies, such as masks and disinfectants and, all the cleaners that we need have been hard to come by, and rightfully so have been reserved for a hospital setting. And I'm curious, do we have a sense for some of the supply chain issues or when we might see more availability?
Right. Well, and again, a lot of the availability in the product has a lot to do with the actual packaging itself. Once we got through the initial hump of that panic, and an understandable panic for sure, where everybody, and someone who has never even purchased as much as a disinfecting wipe before, suddenly had closets full. So once we got kind of past that initial hike, things are beginning to kind of level back off, and things are becoming more readily available. But please understand that, and I got calls earlier yesterday in regards to a village manager wanting to purchase a ready-to-use disinfectant and give it to every household in his village. So in the meantime, that's a lot of cases where we might be shorting, for example, a hospital, a nursing home, or something like that. So we do have to be very careful, but we don't really foresee any major issues now or in the future to meet these demands. We may have to shift production as far as concentration on what products we produce. More disinfectants, more sanitizers versus, some of the other base products that you might find or need in a restaurant. But we don't really see that being a long-term issue at all.
Great. I didn't prepare you for this question, but as we wrap up, I do want to, we're again, the reason for putting this information in a place, Trust20.co, and making sure that it had a checklist, a downloadable communication toolkit, a blog from experts that will be constantly changing, that we're going to update it. The point was really helping restaurants navigate all of this. And as we kind of close out, Rick, from your perspective of having been serving food this entire time, and Eric from cleaning, and I'm just curious if you could do two things. One, a practical tip to operators to take away, just something really bite-sized. And then secondly, something you're kind of optimistic about in this world. I think, it's really easy to talk about all of the things that won't work, but it's also, these are the times where we evolve as a society when called on, and I particularly feel strongly about the opportunities coming out of this. So who wants to start?
I'll go ahead and kick that off, if you don't mind.
Yeah.
One takeaway on our side, and it can be very unfortunate, is I'd like for operators to try to avoid as much as possible trying to find that magic bullet, as they say, that one magic product that it's just going to do everything. It's going to clean, it's going to sanitize, it's going to disinfect. Oh, it's also a great window cleaner too. We have to stick to our basics. We have to go back to the food code and make sure that we're doing everything properly. So there's no quick fixes here. You have to follow protocol. You have to follow procedures and best practices laid out by the CDC and the World Health Organization, and so on. One of the things that I'm looking forward to, just me personally, being a professional germaphobe, is the hyper focus that everyone is either going to have or be forced to have on cleaning and sanitizing, as it always should have been. Finding a disinfectant inside of the cleaning closet of a restaurant didn't happen often. So I think from here moving forward, that's going to be very common. So I'm looking forward to that, again, as a professional germaphobe.
Great. Rick, what about you?
I think the advice I could give someone is communicate with the staff. There are so many social media tales out there of what is and what isn't. And I just think the communication with the staff, we're fortunate in a hospital to have an infection control department. I don't know if a health department would come out and talk to the staff or not, but it just, the pre-staff meetings you just have to let everyone know what is going on. And the positive I can take about all of this is our staff has just been wonderful. I guess you don't appreciate your staff as much as you can when they come in every day and they're exposed to, a possibility every day. So I appreciate my staff, I think, more now than I've ever have, which is unfortunate. It took this event, but still, it's really great.
Nice, thanks. Dr. Larry.
So I apologize. I was responding to one of these answers and didn't hear the
sorry.
question. If you just rephrase it, please.
Oh, just one kind of takeaway tip for a restaurant operator. Like, what was one quick thing?
Yeah, I think I can't overstate the role of human interaction in spreading this disease. I know like restaurants are really focused on disinfection, decontamination. That's really, really important. But I think you really have to focus on limiting direct face-to-face interaction, limiting sick people from coming in, and figuring out a way to sort of limit that part of the transmission chain, because that really is the most important. And when these huge clusters of illness have been demonstrated in restaurants and factories and office buildings, it's really been a lot of people in a enclosed space for a long period of time. So figuring out how to limit the number of people into the building who are there at a given time, figuring out how to mask when a customer has to eat is going to be really, really difficult. And creating a culture of personal accountability for both your guests and your staff, I think, will be really, really important, because this isn't going away quickly.
All right. Do you have one thing you're optimistic about?
So, I mean, I am optimistic that this has forced every industry to rethink how to operate with personal health and public health in mind. And I think there's going to be a whole lot of innovations for how to thrive. I know in healthcare already, we've identified ways to see patients without face-to-face visits. You have already started thinking about how to, feed and provide a hospitality service remotely and through using technology and how to stay connected with customers. And so I think these lessons will benefit us in the long run quite a bit.
Great. Okay, Catherine.
Yeah, I think my one tip is that hand sanitizer branded to your restaurant is going to be the new matchbook.
Oh, yeah, that's a good one.
Right. So figure it out either with your local distiller or your local company. But the restaurant branded hand sanitizer and potentially masks are going to be the new matchbook. And the thing that gives me great hope has actually been the restaurants and owner operators so far. I mean, they have pivoted to feeding their community and the most vulnerable amongst it, restaurant workers, the homeless, people who are newly unemployed and newly food insecure. They've figured out how to open for takeout and to go and to save their businesses. They've figured out how to use their voice on Capitol Hill and in the state capitol. So the restaurant community gives me hope, and I am hopeful that 6 months from now, I will be dining in a restaurant.
Great. Okay, Alicia.
Okay, bring us home. Yeah, I would say if there's anything to take away from my portion of today, it's have a plan, work the plan, document the plan, and have it in your back pocket in the event that you need it. But don't do those things, don't work that plan just out of fear of the liability issues. The more important issues are getting your operation back up and operational, bringing people back together, creating community, serving great meals. And I'm optimistic that people are really craving that after several months or weeks in a shelter at home environment, that they're going to be anxious to get back out there. Cautiously, of course. So we need to do all the right things and we need to do them consistently. But I think once again, we'll be around a table celebrating birthdays, anniversaries, and business relationships.
Great. Thank you all for your expertise. Thank you for your ongoing partnership with Gordon Food Service, Trust20.co. We're so grateful for the conversation, and to all of the attendees, thank you for participating, and we look forward to your engagement through Trust20. Bye-bye. Take care.